What breast reconstruction's real goal is, in my view, is about getting it so that you can forget that you'd ever had the mastectomy. And the way we do that is by rebuilding something that really is about fooling you. When you glance at yourself in the mirror, it's so that you can't be reminded. My name is Suhail Kanchwala, and I'm a plastic surgeon here at Penn Medicine. Unfortunately, most of my patients are in the prime of their lives, and all of a sudden, there's a big roadblock that's put in their world, which is the diagnosis of breast cancer. And then once they grapple with that diagnosis and they've met with a breast surgeon and often an oncologist, they've come to the decision that they need a mastectomy. And my job is to talk about how we can repair them beyond just fixing the cancer, because thankfully we are incredibly successful at treating breast cancer. It's a very, very treatable illness in most cases. What I'm lucky in my life is to be awed by the patients that I see, because quite frankly, they're going through the probably roughest period in their lives every single day. Part of the surgery is developing the relationship with the patient. And so even though I'm done with the surgical interventions, I don't ever want to be done with the patient. And it's incredibly uplifting to watch their determination, their grit, and their resilience, because it makes my problem seem so small. There have been some massive advances in what we're doing. And so what we've worked to really develop is fundamentally changing the surgery to make it much more minimally invasive. We've invented robotic techniques and laparoscopic techniques to allow us to do the same surgery without the kind of recovery that used to be required for some of these more complex procedures. And so in many ways, we can do anesthesia differently, manage pain differently, prevent pain in the first place, so that the majority of our patients are now able to have even the most advanced techniques done without resorting to the need for using opioid pain medicine. I would tell you that for the overwhelming majority of patients I take care of, the courage that they express is really just nothing short of amazing.